about viral hepatitis and HIV infection in the Czech and Slovak Republic. Even the data are low because we are small countries and we are a little bit lazy in HIV, HBV, and HCV, so numbers are low. But we are good in colorectal carcinoma and in drinking beer. So, about HIV infection in the Czech Republic. Czech Republic has 10.5 million inhabitants, and total number of diagnosed persons, Czech citizens, including Czech citizens and foreign residents, are 2,430 persons. 317 HIV-positive persons had died, and living are now 2,113 persons. The prevalence is 231 persons per 1 million inhabitants, and annual incidence last year was above 200 cases and is slightly growing. The most common HIV genotype is genotype B, and we can say that the prevalence of HIV infection is about 4 times higher in foreign residents than in original Czech persons. Here are cumulative numbers of our HIV-positive persons. The first 3 cases were in '85, and blood donor testing was done from the beginning for HIV at the beginning of 1987. The sex distribution of HIV-positive persons in the Czech Republic, 84% are men, and the most common mode of transmission is in MSM sex, and in heterosexuals, in MSM is about 64%, and heterosexual are the mode of transmission by heterosexual mode is 25%. IDUs about 4%. In the Czech Republic, 7 HIV centers exist, and about HIV patients cares about 14 HIV experts. And Prague, this biggest center where I am working, cares about more than 7% of our patients. Drugs are available, almost all, which are available in Europe. What about hepatitis B and C in the Czech Republic? The prevalence in common population, the prevalence of HB-sAg is very low, 0.1 or 0.2%. Prevalence of the past B infection is above 3%. And as in other countries, of course, acute hepatitis B is, the numbers are falling down because of the vaccination, which started in 2001 in newborns and in persons, in children in the age 12 and 12. Annual incidence of hepatitis C, the numbers are stable, is around 200 to 350 new cases of Hep C together, acute and chronic, every year, and prevalence of anti-HCV antibodies in the Czech Republic is 0.4%. Anti-HBV drugs are generally very well available. The other situation is in treatment of hepatitis C, because still we can treat by Pegriba and first wave PIs. Telaprevir is not, I don't know why, by telaprevir is not possible to treat HIV positive patients in the Czech Republic, and Cimeprevir is available and covered since April this year. Registered are also new drugs, but in process is negotiating about covering, because the Czech health insurance are not very open sometimes when we ask for new drugs, and we play ping pong with our patients. So they had for them, but I don't know if for our patient, good idea to send from Japan Asunaprevir for free. The prevalence of HBV and HCV infection in HIV-positive patients, we don't have exact computer data, but we did it in more than 50% of our HIV-positive patients in our center, where we did it in more than 80% of our patients. We have data from 960 and 935 patients from the center and from Prague, and colleague Snopková from Brno did these markers, B and C markers, in 162 patients, which have good compliance and are following our recommendations and goes to visits. So prevalence of HBsAg in HIV patients in the Czech Republic is 2%, past B infection 38%, and anti-HCV positivity is in HIV patient in 11%. HBV infection in HIV-infected person in the Czech Republic is treated according common recommendations. We recommend all patients with negative anamnestic antibodies to vaccinate our HIV patients against Hep A and Hep B. We have very old data from the low number of patients which are mentioned in the graph with results of our vaccinations, and we recommend we try to do in every B and C positive patients to provide anti-HIV test for HIV with informed consent. The distribution of HCV genotypes in our HIV-positive patients is very similar to Eurasida cohort. Of course, we cannot compare these numbers because I did it in our 38 HIV-HCV co-infected patients which were treated in our Prague center and in which we know SVR. So distribution is similar as in Europe, and subtypes of genotype 1 is similar for genotype 1A and 1B. We can call genotype 4 as a new genotype in the Czech Republic because our hepatologists are telling that they have no experience with this genotype 4, but in our HIV positive patients, especially MSM patients, are, we can call as frontmen for genotype 4. And so now we can tell that genotype 4 is one of the most new, one of the most common genotypes in new HCV diagnosed patients, which HIV co-infected HIV co-infected patients. If we want to know some numbers, we can calculate if we have 11 in the Czech Republic, if we have 11% of anti-HCV positivities, and we calculate that maybe 75% of them have recent HCV infection, so maybe in the Czech Republic we have 170, 150, 190 HCV positive, RNA positive patients. If we calculate from our Prague center where I work, how many percent of HIV-HCV co-infected patients were treated, it's about 50% and about 20% succeeded SVR. All of them were treated by Pegriba, and our success was 42%, and the worst results we have with genotype 4 even, we can call it the patients, the hepatitis, we can call in these patients as a young infection. In Slovak Republic, the distribution of according to mode acquisition is almost the same as in the Czech Republic. There are 5 centers with 10 experts which cares about HIV positive patients. The numbers of HIV positive patients is still 600, a little bit lower than in the Czech Republic. 44 patients had died, and annual incidence is about 80 new cases per year in the year 2014. Bratislava cares about more than 80% of patients. How about the situation in general population with Hep B and Hep C? 2 studies were done, or 3 studies, one is not mentioned here, with pregnant women. HB in general population, HB-SAG prevalence is about 3% and past infection about in 16% and is higher in Roma population. HBV DNA is positive in Slovak common population almost in 2%. Anti-HCV antibodies were tested in almost 3,500 persons. The positivity was in 1.5% and recent infection in 0.7% in common population. HBV, HIV, and HCV, HIV co-infection in the Slovak Republic was done in more, we know numbers in more than 50% of HIV positive patients in Slovak Republic, maybe 2/3, and B infection in HIV population in Slovak Republic is 5% and HCV RNA positivity in 5% too. What can I tell at the end? Still is low prevalence of HIV infection in the Czech and Slovak Republic. HIV infection is most common in both countries in MSM. higher numbers in B and C infection we can see in Slovakia, but the numbers are still low too. HCV genotype 4 we can call as a new genotype in the Czech Republic. In Slovak Republic is higher prevalence, much more higher prevalence of B infection in Roma population, and in both countries, especially I can talk about the Czech Republic. We have good access for HBV, HIV drugs, but not still satisfactory for HCV drugs. Now, last year and especially this year, we can treat only healthy person in the Czech HCV persons with HCV infection. We cannot provide genotype Q80K, so we can treat only healthy person with 1B infection, and by PEC-RIBA healthy persons with genotype 3. I want to thank for our colleagues from Czech and Slovak Republic for very important data. Thank you for your attention.